Maybe you want to start putting the display of the program brochure. Dr. Alok, shall we get started? We are 3 minutes past.
Let's start.
Yeah.
Start.
Good morning, everybody. Welcome to this event. Ask us anything. So you are very familiar with we organizing technical events. Last year, we did one non-technical event that was about nurturing career amidst the adversities caused by the lockdown. At that point in time, when we got into the lockdown last year, a lot of us are going through a lot of difficulties and a lot of emotional stress. That event was attended by over 500 people. That gave us an inspiration to say that it is not only technical activities that matter, but emotional well-being and all-rounded well-being is a very, very important aspect. That inspired us to create an open house for our IEEE Communications Society. And we are very fortunate today to have a very, very distinguished entrepreneur, Raghavendra Prasad Rao, who is popularly known as Rags. So I would call him Rags only. So I hope you do not mind. So he is the founder of Project StepOne, and he will be giving an overview of the initiative that has been launched for the well-being, all-rounded well-being through the telemedicine helpline that they have set up at a all India basis. Followed by that, we are really going to have an open panel discussion, and this panel is very different compared to the other very thematic driven panel where we have a theme to say that this is the technical topic, and the panelists bring in different diverse background to talk on that particular technical topic. But this is a absolutely open. You can ask us anything. And since the second wave has caused increased difficulty to all of us, in the first wave, we probably are hearing that, distantly hearing that somebody have been affected, but that is not the case anymore. In our friend circle, in our family, in our relatives, there has been some or other impact, and therefore the situation is looking quite distressful. So this is an attempt really to give a forum whereby everything, be it the career-related issues, be it your emotional issues, be health-related issues, all of this we discuss, or even about the professional growth in the form of IEEE senior membership or membership-related stuff. Everything is open. And by the way, for the membership, there is another event in the afternoon. So that will be addressing specifically about the membership, member elevation, and all of that. Right. So with that background, I would request Dr. Alok to give a little opening remark before we give the floor to Rags for presentation. Dr. Alok.
Thank you, Mr. Suvash. And welcome everybody on a Saturday morning from IEEE Bangalore sections, and ComSoc is organizing this. So as Suvash has already very nicely put it, today you can ask us anything. So whether it is technical, whether it is career, whether it is growth, whether it is on difficulties and challenges, we would be trying to answer. We're not specialists on all topics, but we'll do guide you with our knowledge and experience that we have. So as IEEE, you all know, and many of you have been attending other programs, so I'm not going to go into that side. A lot of 5G, beyond 5G, 6G technical topics we have been covering on Wi-Fi, 6, 7, all kinds of ultra wideband, new technologies, connectivity. That has been our mainstream discussion topics. I just wanted to highlight 2 points that if you would like to carry back, that in June, we are going to have a summer school, which is beyond 5G, IoT, human-machine communication. And 10th to 12th June, it's about 6 hours each day. And this is a global event, ComSoc Summer School Series, 8th edition, and we are going to do it from Bangalore this time. And also there is IEEE Bangalore section's flagship event Connect. That's going to be happening in July. So any of you are interested, please join them. We talk about also intellectual property and open source and research methodology. And we just did a PhD, MTech thesis kind of awards, choosing in 7 minutes if you can defend. So those are the kind of other events that we have been doing. And today, as I said, it is not just the technology and not those fronts, but our life is part of in various senses. And before COVID itself, not just COVID, the technology is moving very fast. There is a lot of disruptions that are happening in business model and technology, and sometimes in the employment scenarios, some are booming up, some are going down. People are putting effort in reskilling, upskilling. It's a fast-paced world. Some are able to cope nicely with this agile world. Some have certain difficulties. We have our commitment to families. We have financial challenges. We are all at the same floor. And on top of that, the COVID, has put an extra burden on all of these dimensions and new dimensions. So that's our challenge. And I think today we are putting in that context that any of the difficulties or good points that you would like to share, ask us. It's a very informal program compared to others. So feel free. If you want to remain anonymous, then you can always use the chat box. But it's a small community, so it's up to you as you want to do it. So with that, I think, I'll hand over to Suvash again. And thank you and welcome.
Dr. Alok, for setting that context. So as Dr. Alok said, very informal, 2 hours kept aside. But if questions are not coming, we may be able to wrap it up earlier. But I would hope that there will be enough questions to keep us busy for the full 2 hours. So with that, I would request Chengappa to introduce Raghavendra Prasad and then give the floor to Rags to take us through the Project StepOne. Chengappa.
Thank you, sir. Indeed, it's a pleasure and honor to have Mr. Raghavendra Prasad amidst us this morning. Founder Project StepOne, which is a non-profit volunteer organization helping India fight COVID, providing free telemedicine access to COVID-affected citizens in India. He is an active angel investor and advisor for many startups. His primary interests are in technologies and business model, which can help rural India better integrate with the rest of the Indian and global economy. He is co-founder of Quickwell, a pioneer in digital healthcare in India, which was acquired by Practo in 2015. Rax, as is popularly known as in his circles, has over 20 years of experience in software industry, a computer science graduate from MS Ramaya Institute of Technology, Bangalore. Rax started his career as a programmer working on many mission-critical global products. He loves solving people's problem using technology and has spent most of his career doing that. He has a keen eye for spotting trends and new innovations to solve problems and has launched over a dozen global products, has over a dozen international patents to his name. So born in Bangalore, while work is his biggest passion, he also loves to travel. A marathon runner, triathlete, and a passionate biker, he loves to explore the country on his motorcycle. So with this brief introduction, I would like to hand over this virtual podium to Mr. Raghavendra.
Thank you, Mr. Chengappa. Thanks, Subhash, for inviting me to come here today. And thanks to IEEE ComSoc Bangalore chapter for organizing this event. I will share my screen now and start the presentation. But before I start the presentation, I think we are. I'd like to just start by saying, we are leaving as engineers. There couldn't have been a better time in history, to be around, or there could have been no better time to be an engineer than now. We are having numerous technologies which have become good and accessible to people, that a lot of problems uh, of the society can actually be taken up and meaningfully addressed by engineers. And Project StepOne is actually one example of that, where we have used technology. But technology is not only enough. We need to have the right people as well as the right processes to solve some of the big problems of the society. Um,
Chengatpa,
so,
can you please mute Amandeep? There is a lot of noise coming. Sorry about that.
Yeah, I have done that, sir.
Yeah.
thank
Please.
you. Yeah. So basically, StepOne is one example of that, and I hope we can there will be more such initiatives which can use technology to solve a lot of problems that people have. So what is the problem that Project StepOne is solving? I think I'm trying to get rid of this. Are you able to see my screen without the panel?
Yes, yes, it's all good, sir.
Absolutely perfect.
Yes, Rax.
You are good.
Okay, fine. Okay. So the problem that we are trying to solve, or last year around March, a bunch of us came together on a WhatsApp group. Most of us were founders of various startups in mostly Bangalore. And we knew that COVID was upon us, and we knew that the nature of the pandemic means that you would have to use technology to solve the problem. And Project StepOne was one of the initiatives where I would say right now the only initiative which is alive from that discussion, where we discussed use of technology to provide uh, care and access to doctors and access to healthcare to a large number of citizens. It so the problem that we are trying to solve StepOne is that there is a shortage of staff. There is a shortage of doctors and nurses. One of the key things when we were uh, discussing the problems last year in March was there was a shortage of testing kits, and or rather there was very few testing kits even available, and uh, we could not afford uh, in Bangalore to send everyone to get tested. So we needed to know we needed to be able to differentiate the symptoms from people who need to get tested and from people who don't need to get tested. And we decided that the best way to do that is to use doctors who are potentially the best people to be able to take a call on that, right? Similarly, there was need for people to be counseled, to be at home. We were staring at an impending lockdown back then. We had not seen something like a lockdown, but we knew that other countries who were enforcing lockdown, that it is a matter of time before it comes, and that brings its own challenges. And all of this was happening at a scale which would really stress every existing resource that we assumed for granted. But we couldn't solve those. We couldn't have solved the problem for every resource, but we said anything which requires people, staff, to be augmented, that's the problem that we can try to solve, and that's the problem we took up. And we created what is a combination of people, process, and technology. I'll start with the technology. We have built a platform, which is to give an example, it is kind of something similar to Uber. You can if you can think of Uber. Uber on one hand connects drivers with people who want transport. Similarly, we connect people who are affected by COVID who want help with people who can provide them help. The people who want help are the people who are calling government helplines, who want to, who may have symptoms like COVID or who have been, recently tested as being positive, or have been tested long back as being positive, but they are sitting at home waiting, trying to recover, and they may see that some of their symptoms are escalating and then they need help. Various different reasons for which people who are COVID effective will need help. They are the people like people who need transport in the Uber example, and the drivers are the people who can help them, primarily doctors, right? A lot of people want easy access to doctors, and we we were able to gather a large number of doctors. So right now we have over 12,000 doctors who are helping Project StepOne. But doctors was not enough. We have a lot of allied. We have a lot of other healthcare professionals. We have nurses. We have counselors. We also have a large number of medical students. So all put together, we have more than 20,000 such non-doctors who are healthcare workers who can also help in this process. Plus, we also have a large number of uh, of non-medical volunteers who have been trained. Most of them are corporate employees from various corporates who have taken up uh, upon themselves to volunteer and spend a couple of hours every day in helping others through this platform. So that is the technology and the people part. But since we have been doing this for various, for various um, governments and for a pretty long time, we have also developed proven processes and systems which we can not only deploy but also help governments, in what is the best practices. So a combination of all this is the solution that StepOne provides. The way Project StepOne works is we work as an extension of the government. So we augment government resources with trained volunteers is what we say. And all these volunteers, because we are using technology, need not be physically present in one place. They all can be sitting in the comfort of their homes or offices or wherever they are, and using technology, log in and into this into our system, get cases assigned to them, and work on those cases by calling the person and enter the data, and all this through the technology platform that we have built gets aggregated and sent back to the governments for further help. So um, the and the key for us was that we are able to quickly not only provide technology but also help in running these operations, right? If it's not enough just to hand over a piece of technology to the government and say use it, because chances are that they may not have the ability to operationalize a piece of technology. So we actually run this end to end. So for the input for us is these calls that come in or the data that comes in from the government, and we give them back data as well as we connect the patients to the right government. Like for example, if somebody needs an ambulance, then we connect them with the ambulance system on the ground. If somebody needs medicines, then we connect them to the people who can supply them medicines. So that's essentially what we have built. So what is the complete solution starts, we are helping government right from the time someone has um, any COVID-like symptoms and is calling a helpline. That's what we call as COVID suspect triage. We provide mental health counseling. We have a large number of people, volunteers who are volunteering on StepOne to counsel patients. As you all know, mental health is been one of the greatest challenges, which is not exactly COVID, but is affecting a large number of people who are even those who are not directly affected by COVID. Then we also do COVID positive triaging. As soon as somebody is declared positive, typically they get, in a lot of states, call from a volunteer from StepOne to communicate the news, as well as talk to them and understand what their symptoms are, what their comorbidities or existing ailments are, and guide them based on that. Guide them. In fact, when we call them, already a lot of people are in emergency. Yeah, and on a daily basis, we handle hundreds of such emergencies and shift them as quickly as possible to a nearest healthcare facility where they can be handled. Similarly, the there are a large number of people, as you know, who are recovering at home. It is very important to keep monitoring their health to ensure that their symptoms don't get more complicated. And we do that. We do that for lakhs and lakhs of people every day. And we also help people with obtaining plasma, provide support for post-COVID issues, and most importantly, we are helping a lot on the vaccine rollout. Right from day one of the vaccine program, we've been helping various governments with setting up vaccine helplines, as well as managing the end-to-end process of vaccine to be able to vaccinate as many people as possible in the quickest possible manner. We what started as a desire to do something small, maybe even in Bangalore, has actually become a very big, you can say, movement. I would say it is, uh, yeah, we never ever imagined in our lives that we would end up having to do such a large program. Many states as well as cities are dependent on Project StepOne and we are an integral part of this fight against COVID. We work both at the state level as well as at the city level. And now increasingly, we are also working a lot with non-government entities, basically because as in the second wave, the virus has actually spread into a lot of rural and tier two outside the big urban centers, which means that the testing facilities are not good in these places. And a lot of times there is a lot of stigma still associated with becoming a COVID positive patient, which means people stay away from testing. But unfortunately, that is not a good thing. We need to somehow provide a way by which even everyone feels comfortable calling a helpline and seeking help. And we are working with other communities um, who can provide potentially comfort for their own constituents to be able to reach out to a helpline and get help. We are also still growing. On this list there is Assam is missing, which we are hopefully going to go live very soon. Rajasthan, which again we'll hope to go live very soon. In terms of our operations, we are managing more than 1 million calls every day, which is a huge scale. It is been a technical challenge for us to be able to manage that scale, as well as it's a challenge in managing such a large volunteer force. We have over 30,000 people who are volunteering with us, and at any point of time, over 5,000 live people will be helping COVID affected people, patients. In terms of the recent impact, we have done over 2 million teleconsults by doctors. Then on a daily basis, we manage roughly about 20 to 30% of India's daily positive caseload. We also get roughly uh, we manage about you know I think right now it is about 3 lakh patients who are in home isolation whom we help on a daily basis. So yeah, it's a huge scale, and all of this is being done free of cost for the government. We don't take any money from any government, and we are able to do this free of cost because It's mostly volunteer led. I'm a volunteer myself, and we have 20,000 odd others who are volunteers on this platform. As I said, doctors and various different professionals who are helping us. And of course, we also have almost work like a tech company. There is technology, there's a tech team, there's a product team, there's an operations team, there's a marketing team, there's a HR team, and of course then there are teams of volunteers, doctor volunteers, mental health volunteers, and groups of so it is we are trying to automate as much as possible, and all of this is virtual setting. Most of us have never seen each other, never met each other, but we've all gotten united by this common goal to save lives, prevent morbidity, and hopefully prevent the spread of COVID. So um, I will actually skip all of this. And yeah, so we have a huge multilingual doctor force, which I would say is the backbone of what we do, and that is enabled because most top doctor associations have supported us, and we typically are a invisible force. Most of our work gets reported in the media as as a CM launching a helpline or launching something new, um, because we most of our work uh, is uh, in the back end. The government takes the front end. Like for example, in Bangalore, we do the home isolation monitoring. We do COVID positive triaging. We have done mental health. We are doing mental health counseling. But the people call a government helpline, and from the government helpline, a lot we run an IVR, for example, on the government helpline and take calls towards us, and manage all the calls that are coming towards us. We have been able to, so in most states, we are an invisible force. And most of the times, the we never meet the people whom we help, but they actually send us messages, and sometimes they write poems for us. Uh, on very rare occasions, they send us a cake. But yeah, it's mostly these virtual thanks that our volunteers get from the work that we do. And we've also been rewarded some very prestigious awards. We were recognized by UNICEF. We won actually a global award by Amazon Web Services, AWS, and Intel. We were the only Indian organization to win this award. It's called as the Game Changers Award. And we also won the CII, Indian Women's Network Advocate Award. So there's been a lot of recognition that has come for this effort. And there are also various testimonials I and, from uh, various people. Maybe I can play maybe one of them. Uh, is that okay if I play one? Maybe.
Sure, sir.
Absolutely, Lax. Please go ahead.
Okay.
Absolutely.
The audio is not coming.
Okay. Maybe I think there's another setting for audio. So I'll skip this. It's okay. There are a lot of testimonials which have come forward for and let me go to the next slide. The way we work is, as I said, we give what we do as free to the governments. We don't charge anyone, but we try to also get them to comply with uh, certain conditions that we have for getting involved. Typically, so that we ask them to pay for the telephone systems that gets used, and luckily the Department of Telecom has allowed us to use lines in spite of they not being owned by us or physically getting terminated by us. They have enabled us nationwide routing of calls, which is a huge change. By a special order, they have allowed us, which has actually helped us to have data centers only in a few cities in the country, but be working with any with any state virtually. And we also insist that there needs to be a minimum level of on-ground support that the government should provide. They should be able to deliver medicines. They should be able to send ambulances and things like that. But I know when this second wave especially has put every available resource in the system on tremendous stress. So we are also I think every possible resource, whether it is uh, ambulances or hospital beds or medicines or oxygen, every infrastructure has been has fallen short in the second wave, which has actually been a challenge for us. But it has also meant that we have to work a little harder. We had to work with a lot of non-government agencies. In fact, right now we are working with a lot of non-government agencies, for example, to provide oxygen concentrators at home, oxygen cylinders at home, um, creating the ability for people to get medicines delivered free of cost. We have a large number of people who are doing that in various cities, and we work with them and tell them who are the patients who require that. There are a lot of step-down hospitals that have come up, which are helping people. So we are actually in the process. We are in many places tied up with a lot of them, so that if the government infrastructure is not able to help, we are able to go to these organizations to help the citizens. Yeah, so I would say uh, the volunteers, one of the things that certainly I have learned is volunteers are not paid because they are priceless. So it's yeah, so with that, I would like to stop my presentation and others for the rest of the program and any questions.
Yeah,
Rag,
thank
what
you.
a
Thank you.
great session. Yeah.
Thank you. Thank you
Yeah.
so much, sir, for sharing the insights on what actually the Project One is doing in this troubling pandemic times. And absolutely, as you mentioned, IEEE is also most volunteer driven, and we can connect there. And absolutely, you made a point that we cannot pay for volunteer because that is purely out of passion, and they are very valuable to drive the things aligning to our vision and mission. So with this, we would now open the floor and would hand it over to Subhash Da, who would be the panel coordinator for this Ask Us Anything session. Yeah, over to you, Subhash Da.
Yeah. Thanks, Chengappa. So, Rags, what an amazing initiative. Uber for free, Uber for social welfare, not for profit. What a initiative. Amazing, amazing stuff. And as I was telling that I have heard so much about you through my wife, because she is just a volunteer to provide emotional support as a frontline. And the amount of effort that has gone in is so phenomenal that NIMHANS was roped in, and NIMHANS organized a counseling, I would say, induction for those who have never done counseling in life. And it really, really means so much that, and really, really, all of us, thank you so much for taking this initiative, helping people at distress. It's just phenomenal. With that in context, uh, we actually are having a very, very distinguished panel here. And thanks, Rags, for setting the context in this difficult time, I would say, or challenging time, rather. we thought that we do this open house with a mix of people coming from industry, academia, so that all-rounded aspect could be covered, because we are doing it for the first time as a open house. So maybe what I will do, I will open the floor before we take the question from audience. I would like each of the panel members to briefly introduce themselves. So I'll just talk 2 lines about each, and then they can do the introduction, and then others can start asking questions, right? So I'm just keeping it very simple. So as I see in my screen on my right, I see Subodh. Subodh is with Cisco. He has been involved into quite a few social welfare activities in the context of pandemic. So he is a COVID champion in his apartment complex. He is a COVID champion in Cisco. Maybe Subodh, you would like to introduce yourself before I go to the next.
Sure, Subhash. Thank you so much. And what a context, Rax, if I may say so, right? I think the way
Sure,
you
yeah.
etched out step one, and precisely how it really moves the needle where it matters the most, right? Bringing, whether it's a breakdown in the task forces, breakdown in the medical healthcare, or the glaring gaps. So the whole perspective of not finding fault or complaining, but just moving the context to empowerment. I think it's superlative, very nice. Uh, Subhash, to your point, uh, very similar to what Rax has done, but on a very smaller scale. The work done within the community or even within the Cisco COVID task force has been more about just basically getting that unseen data through bots, just writing a few AI bots so that all the employees get benefit of the latest things, whether it's finding the right injections, hospital beds. And I know there is a lot of ambiguity over that, but I think this was some of the things where I personally realized, especially for technologists and engineers, this is what appeals them the most, right? The ability uh, to make visible what is unseen or what is ambiguous, and to just bring it to the fore, so that everyone benefits. And the larger good always has to be that the societal needle has to move forward, and not the technological or the commercial needle. And I think that's what Rax also very clearly about, and that's what it has been. So what I do as my life in Cisco is just designing and implementing service provider, enterprise, or secure networks. But was very humbled and privileged that around 250 of us in Cisco managed to just put little of this together, of course, guided by our leadership. And that's when we realized that there's so much more we can do, right? I think what Rax and his entire team has done has demonstrated that it can be done with small, focused efforts. And I think the impact they're causing is tremendous. I was personally very inspired to hear and listen to Rax. Thank you.
Thanks, Subodh. Then I think I will move to Dr. Alok next.
Thank you, and thanks, Rags, for wonderful work as well as spending time here with us to share your, activities and thoughts. So,
My pleasure.
Sincerely appreciate that as chair of the IEEE ComSoc Bangalore chapter. Obviously, IEEE itself, as Subodh was mentioning, we are also volunteers, and we do try to bring in different dimensions. So we understand the value of volunteering, and it is, priceless from that angle. We all have our day jobs, but on Saturday, spending 2 hours sharing with a set of people, it is with a good intent. Now, on top of that, which I introduced, what we do in IEEE, I think from Samsung's standpoint, we obviously have the responsibility of technology, and whether it is 5G, multimedia, AI, IoT, those are the kind of activities. And I call that, as physicians and the community, the medical, non-medical support, as they are struggling and fighting this battle and in the front line. Obviously, we are behind and giving them support. But at the same time, I think liveliness, is also, and livelihood is very, very important. So I think life and the livelihood both are important, and we are creating many different technologies. And it's nice to see that many technologies that we build, but where do they go and how do they help people? And people like you bring it. So I have in my charter, technology for all. So if we can take it to all the people in some way or the other, uh, we are even launched a program called Galaxy Upcycling, which means even if you have a 3 generations behind phone, it has enough processing power. Can we use it for some purposes? We used to have these PPG sensors in older phones, which can measure the SpO2 and pulse rate there. So even this simple thing that is already there and people have it at home, even they don't buy it, people can use it. So these are some threads that we are bringing in. And as a community, as a corporate, we could also discuss if somebody is interested, how employee welfare, when they or their families are affected, what we could do, how do we support them? Obviously, organizations like yours are behind to support. We can just initiate and kickstart, but then that gets plugged into those kinds of marketplaces. And then obviously, also reaching outreach programs, which is more about, helping others, with oxygen concentrators, cylinders, and other things that are there. And then, people growing their career professionally, even this is a time, but the time is time, right? In 2 years' time, when everything goes by, this time will be lapsed. And if somebody has utilized this time for their career growth versus somebody has not done, there would be a difference because world is moving. Many other countries are opened up. Therefore, how can you, if you are in good health, then it's a God-gifted time to you. How can you utilize that for benefit of your own well-being and people around you? So with that, I will pause here and we can discuss. Thank you again.
Dr. Alok. I would now request Dr. Shobha to introduce yourself and share a little bit of your perspective as well.
Yeah. So first, I would like to appreciate Raghavendra Prasad sir's efforts in helping the society. So me being an academician, we are trying to look at the welfare of the students. So we have been associated with a lot of social welfares as well as the student community welfares. So we have taken up a lot of activities during the COVID times in order to give moral support to the students, as well as I am involved in a few of the societal needs like NGO communities where we could be helping the societal causes. So I work at Ramaya Institute of Technology as an associate professor in the Department of Telecommunication Engineering. So in my purview, what I could contribute to my student community and the society, I have been trying to do my best. So that's from my end.
Great stuff, Shobha ma'am. I now would request Professor Naveen to introduce and say a few things. Professor Naveen, you are on mute.
Bandwidth might be an issue.
Yeah, looks like. I can see an earning triangle. So that is an indication of bandwidth, I guess.
Let's go ahead and start.
Yeah, so while Professor Naveen comes back, maybe what we can do, we would take questions. So floor is open. Anybody could ask any question.
Yeah, hello. Hello.
Debashree, I think you are trying to speak,
Yes.
but we cannot hear you.
Hello, am I audible?
You are now.
Okay. Thank you, sir. Like I have a couple of questions for Raghavendra, sir. First of all, very wonderful initiative and presentation. Sir, I have a couple of questions to ask. My first question is that, like all we know is that in this situation, the resource, like or the medical resource, is a key thing. And we see a lot of resource scarcity, like the oxygens, medical practitioners, etc. And it's obvious that if we have a single doctor and 1,000 patients to look after, it's not possible for us to do. So my first question is like, how optimally you are using this platform to check these patients or deliver the resources? Because it's like impossible for a single doctor to serve all these patients. This was my first question. And the second question is that, are the volunteers working in this StepOne organization online, or like you have the offline issues? Like suppose like connectivity, getting into the platform is an issue here. Like until unless we report something, we cannot get the service. So the second question is like, are there is kind of offline activities like where the volunteers go in many places to see, observe the situation? So is there any kind of thing you are doing?
Yes, so I will start with the first question. Obviously, it is when resources are very important. Specifically, if there is no oxygen, for example, the it is very, very difficult, but there are certain things that can be done, which gives and buys the patient some time until that resource is found, right? I think specifically in case of oxygen, there can be proning, which is a technique to make sure that your saturation levels goes between 5 and 10 percentage points. And there are certain medication that can be administered I think at the peak of the pandemic, in most cities, only a small percentage of people would actually get the bed, but you still needed to save lives, right? So there are certain medication which will help which are normally not administered in a home setting, but they were made to be administered, and they help. So there are ways by which we were able to handle the resource crunch. But specifically coming to doctors, there are not enough doctors in general, which is why we used a lot of people who were so the way the the symptoms were actually in the second wave, there are very few asymptomatic people, but there were a lot of mildly symptomatic people. These are people who don't need to speak to a doctor. So what we used to have was only the people who had we trained a large number of people on the COVID triaging protocol, and we would filter out from the doctors those people who don't need it to speak to a doctor. So that was one thing that we continue to do now. Otherwise, we can't handle the kind of numbers that we are handling. And even for moderate cases, what we saw was, third year, fourth year medical students are capable of handling, because in most cases they're only administering OTC drugs and or OTC medication, and not having to make any clinical decision with respect to giving anything beyond that. So we were able to control it that way. I think this is a model which works. We tried using bots, but what we realized is that this is a human. There needs to be an emotional connect between a person and between two people. So someone talking, even if they are they're only giving them moral support, goes a long way than a bot giving them actually perfect prescription medicines. So we as humans like to talk to another human to get comfort. So yeah, I think that's where there is a limitation of technology, so to say, and potentially the next generation of young engineers on this call will work on how to make technology more emotionally connect with human beings. I hope that answers the first part of the question. The offline, yeah, we work with a lot of organization which work on the ground. First is we had the entire government machinery at our disposal. We were able to use technology to make that resources more faster available. For example, in Delhi, as soon as a doctor marks an emergency, the system would automatically send a dispatch to the CATS ambulance system, which would book the ambulance. And we had near first world turnaround times in some places for ambulance with Indian touch, because sometimes the patient would say, even I want to go to the hospital with my father, but we cannot get the uh, the patient's caretaker to go in a COVID ambulance. So we would also arrange a cab along with that. So that's the first world experience of getting the ambulance home in 10 minutes, but also getting the Indian touch of also getting a cab. So that is one example I use. So we had the entire government machinery at our disposal. Plus, when we also started working with several NGOs, as I said, Robin Hood Army, Hemkund Foundation in Bangalore, KVN Foundation. There are various NGOs who are working. Some political organization, religious organizations. All of them have come together to create resources when there was a shortage, and we were able to tap into all these resources because we were the top of the funnel, or we were funneling the demand to all these resources. And of course, there are issues. There are a large number of people, as I mentioned, who are outside the COVID testing system. You know, if somebody is tested positive, the data automatically comes to us through the government. But there are a lot of people who are having symptoms who decide to not get tested because they don't have access to testing, or they are stigmatized, or they're afraid that they'll be stigmatized, or they just don't care. You know, they're just careless. You know, all these are valid reasons, and we are trying as much as possible to also involve them in this in this. So we are working, for example, with a couple of NGOs who are going door to door in certain villages and collecting data of people who are symptomatic, and once they collect the data, it comes into the system, and we can take over from there and provide remote support. So similar things are what we are working on. We believe going forward, we'll do more of that and have a lot more on-ground support, especially because the pandemic is moving to the areas where that will be absolutely a necessity and not an option.
If I may just ask a question as a follow-up. You know, you said, you know, you're invisible force and the government is in the forefront, like that's how you're getting the information, or you're working through the NGOs. You gave some of the examples. So organization like us, let's say IEEE has many members in Bangalore, our Communications Society, but even Bangalore sections, or even Pan India for that matter. If they have a challenge, some of them are part of corporates and fine, but if any of them has a challenge, and you provide this service, how do I communicate to them that they could get this service? How do we connect that dot? Can you help us understand that better?
Yeah, so we have something called, we have a single number to which they can call. I will share this number, which is a number which is available across the country. But in most states, they can call 104 or the local COVID helpline. It is different in different states. It is 1-800-111-747 in Delhi, 14410 in Odisha. Yeah, different numbers in different places because the number launch is a political event, so the politicians launch a new number.
So it
to
is
show
still
to
through that normal state COVID helpline number, right? You are at the
No,
back
so we
end of
also,
it.
yeah, we also have our own helpline for 97456, which
So
can be,
that's
that
also
is,
people could directly, if
we
we
could,
will
yeah,
be
they could
allowed
directly
to
call.
advertise into our IEEE society that in
Absolutely.
case you need a help, please dial this number. I can say
Yeah,
that, right?
yeah, absolutely.
Thank you. Great.
Maybe I will do a little bit of finer aspect on top of what Raghavendra said about the platform, because I have seen it from close quarters. So Devarshi, to your question on the resource optimization, you being a wireless researcher working on resource optimization, I think I will give some finer aspect of the platform. So Rags talks about connecting and Uberizing the doctors where there are not enough resources. So the good part about this platform is it has a fantastic workflow engine. So if a doctor has, say, spoken to a particular patient, and for emotional reason, the person would like to talk to the same doctor, it happens many a time, but doctor may not be available. But then it is like a cloud native architecture. The second doctor could be taking it because the data is persistent, right? The entire history is reported. And I have seen this, that it is really done in absolute real time. And the very next moment, the other person can take up exactly all the state information is into that database, right? So that is how I guess it has managed. But yes, you are right that resource crunch is the biggest issue. Getting the enough volume of the doctor is the key. It is like in Uber, if car is not available, car is not available, right? So that is something. But with the pooling mechanism, you can to an extent minimize the impact of it, right? And like Rag said, I also have seen this in the emotional aspect. I thought I little bit talk about that there has been many cases where this community has gone beyond. So there was one case, one person from Rajasthan, I think, calls up to say that because of the no action from the authorities, he was a daily wage worker. He is going to commit suicide just to prove the point to the authorities that they are not doing anything for us. So the intervention was really done. The Bangalore people really reached out to the Rajasthan government, and then the case was actually handled. And he really got the help that he was looking for. So this connectivity, I say this is the magic of connectivity that it can do. And this is just one example that I knew. And this is so phenomenal. The amount of help it has given to the people is just phenomenal. So I thought I will just add that to your question, Devashi. So before we take the next question, I thought, Navin sir, we uh, lost you while your turn was there for introduction. So maybe you would like to see your perspective with a brief introduction.
Yeah, thank you, Subhasda, and I think thank you very much, Raghavendra. It is a really very appreciable work, very good work at a correct time. A lot of appreciation for you and your team. So thank you very much, and good morning once again to everyone. And I think this is a very great session. We try to do and bring all the interested people, irrespective of your type of idea. And we are not always technical, as Dr. Alok has already mentioned. So thank you for joining this session. So myself is Dr. Naveen Kumar. I'm working as an associate professor PC department at Amrita School of Engineering, Bangalore, Amrita University. So for last 1 year, I am also heading this ECE department, and we have I think this is the largest department we have. So I'm not going to say anything about technical, but during this time, we also find a lot of challenges. Because we conduct examination, we do online classes, everything is online today. And apart from that, when you have examination, when you have classes, and we are receiving as a department head, you receive a mail, you receive a call from a student that I got affected by COVID. Now what to do? How can I write examination? And there are several such incidents. And not only that, even we have received, I personally received a mail from the student that he or she lost father, mother, and now this became a very challenging issue for us, what to do. So recently, I mean, this was a lot of, but our university was a little bit strict before that. No, if there is a term examination, okay, you can consider this. But when it is a final examination across university, it will be difficult. So there was nothing like a regulation that if you miss exam, you miss exam. That's all. But now we have to reconsider all these issues, and we try to resolve, and we find out, we communicated to them. If you are residing in one house, for example, parents, mother, sister, brother, and if anyone is affected by COVID, then you don't have to worry. Just intimate us, and we will arrange semester or final examination at a different time. So this is done. And a lot of this now everyday basis actually we are getting. And I'm open to, definitely I call back, I reply them, and we try to say that, okay, we are there with you, don't worry. all this happened, we are also suffering. So a lot of resistance was there from the student initially that you are so rigid, no, how we can do it. But then we started talking to them, and I think now thing has become normal. Student also understood well that we are with them, and no, we are somehow managing and helping them, rearranging everything, whatever we can do. But what I'm trying to say is, I'm not in the field as you are doing, but being in academic environment, this is also the case. And whether you are working from background, like how we are arranging this session, this is also a background, no, from behind we are working, trying to say. So definitely in this scenario, somebody is a workforce who is in the front line, somebody is behind, but our motives are same. That how, if we are okay, we have to help each other and so on, and that is what we are doing. So in this situation also, we are definitely with them, and we are trying to help them, and this is what is happening. But I think in university level, in my department itself, our department itself, more than 100 cases are there. And I think around 5-6 cases where this young student, first year student, they lost father, they lost mother, and so on. So it is very grave situation, but okay, somehow we are trying to overcome this. So with this, I just finish, and the session is open for any query, any question. Thank you.
Thank you, Dr. Naveen, for bringing that. So there is one question from Pankaj. So Pankaj, I could read out, but instead, why don't you just unmute yourself and speak your question?
Okay. Hello all. Thanks for arranging this a great session, and thanks for Raghavendra sir for this network, and then network at much needed time, and this service. So actually, I am Pankaj. So actually, currently I am working in Radicis as architect in the 5G domain. So actually, I have total 15 years of experience in various technologies from 2G to 5G, and I mostly work in DSP physical layer related product development work at network side. So actually my biggest concern is that actually I have some product ideas or product innovation ideas that I have submitted to various companies, but I don't have any publications and patents to my credit. So actually, can the experts help me, like how I can start and implement all of this process, like from the level of ideation to doing the actual work, and then get the final result, like get papers and patents published. And then this is all actually by managing the family and the regular heavy workload. So, and then as I mentioned, I am interested in areas like AI, ML across wireless stacks, and then millimeter wave MIMO, massive MIMO, and so on. So it would also help me. And also actually I feel that I'm somewhat stagnated in my career. Like I am doing the same things over and over, but for the same, means the similar things over different technologies. So how I can take my career to the next level? And then actually another thing is that my previous academics was not so good. So, and plus immediately after my graduation, actually I started working, so I could not get a chance to do my MTech or research and so on. So I have continued working into this domain. So if the experts can help me, and then if someone can actually mentor people like me, it would be really great.
Thanks, Pankaj. So I will summarize. You have 3 parts into your question.
Yeah.
First part of the question you are asking is that you have done patentable work, but you have never filed a patent. How do you go about it? Second, you have done quite a bit of investigative work on the digital signal processing, which you think is publishable, but you have never published a paper. The third thing is you feel you are stagnated in the career for whatever reason, and you also feel that because of the work stress, you are not able to take your innovative work in the form of patent or publication, and hence you are stagnated. So did I summarize your question, your 3 concerns correctly?
Yeah, so actually one thing is that like mostly I'm stuck with how to find new ideas and then how to actually do the work and get it done, because my nature of work overall is actually a product development, all stages of product development. So I don't work in something like wireless system engineering and so on, so where there is a lot of scope for doing innovation and research and doing all of these things. So means how I can actually start this process and how I can generate ideas and collaborate with people and actual do this work actually. So this is actually one of my biggest concerns.
Yeah, so maybe I will request Dr. Alok to take, because he has been mentoring a lot of people across the ecosystem, and Dr. Alok's team perhaps generate one of the most number of patents in the ecosystem today. So Dr. Alok, why don't you take
Thank
this
you,
and then follow
Pankaj,
that?
for asking the open questions and
Thanks, sir.
bringing your concern. And it is not just your concern; it might be in many people's mind, but you are expressing very boldly. So thank you for that again. So when mind gets cluttered, let me just take a step back before we answer very specifically. When mind gets cluttered, there are many things that you are talking, how to ideate, how to take it forward, how to grow career, patenting, publications. It's a lot on top of your day work to keep the job rolling, and trying to do so many things is a little bit, overwhelming, and particularly in this time. So definitely first thing, and which you asked, is a kind of mentor, not technical mentor, not to get first level technical mentor, but who can help you out a little bit of prioritizations, like, what comes first and what's next, because all we
Okay.
cannot do simultaneously, even in good mind with our kind of experience, even then we cannot do it. We have to take one or two things at most at one time. So I think we have
Yes,
in
sir.
our ExeCom members from also Radisys. We could request him to also work with you. But any of us offline, we can connect back and try to help you out in this process of little bit filtering, decluttering the mind, setting the priorities, so that this is first, and this, if you can complete, then only the second step would be helpful. So this is my first answer to your mental process part of it.
Yes,
Now,
sir.
let's say
Thanks.
you have done some ideas. Yeah, sorry. Did I? Yeah, please.
Yeah, so some ideation work I have done and then I have submitted few
Yeah, I was
white
coming to that.
papers
I
and
was
so
coming
on.
to that.
Yeah.
I heard you. I heard you. So that is the second part I was saying, that fine, this is one part of it. Now, let's say you have done some ideas. Now, many ideas come. You know that even whether it is startups or in any company, we start with 100 ideas. Typically, they say 100 ideas, then 10 becomes meaningful, and maybe one or two takes birth as a startup or as an entrepreneurship, even in the companies. What is the difference? I mean, then forget the numbers and ratios, is basically something is just ideas. They are not coherent. Sometimes it is coherent, but maybe others have done. Some things are too forward looking, so it is hard to implement if you do not have a platform of today's going into that. So I think we can, while we talk separately, we can also see your specific idea that you have done 1, 2, 3. If you can share with us, we could help you out to say that maybe these 2, 3 are quite good, quite relevant, is meaningful. So this is
Okay.
one part. Okay. Now, coming to how to patent, we had done last year a session of 3 hours. I think 1,000 people, close to that, people attended. And later, I think I have heard that 5,000 people have viewed that video. So I'm going to request, maybe we can give you the link. You can have a look into it. That talks about gradually how to file first patent. So it is step by step, not the process part of it, but the ideation. Actually, it addresses a little bit of your concern. And
Okay.
IEEE, India Council, I'm speaking on 4th June again on intellectual patent creations, what, how, why. on the next week, so you could also attend that live. So that's on the videos and sessions that are there. You also mentioned about publications. Dr. Naveen has done many research methodology, how to write authorship lab. These are also captured in videos. I would encourage you to, again, see one of them and get that clarity how we can do this. So on patent and paper, there are things that could guide you, not on the exact content, but at least are you following those processes? You yourself can do some self-assessment and correct if it's required to get into that. Now, once you get into it, it is still not complete because, as I said, idea is relevancy. Why some corporate would like to take your patent, they have to pay for it. It's a much complex process because you are part of one organization. If you throw to another, you're still an employee there. So it is much more than that. I would not cover that. But I think if you do your first part of mental decluttering by mentorship, if you look into patent and publications, videos, and some other resource informations, and then if you can do some offline checking with us to prioritize the ideas that are there, which could be relevant, after that, we can talk the next steps. I think this would be my answer.
Thank you, Dr. Alok. So, Pankaj, what I'm going to do is I'm pasting the IEEE ComSoc Bangalore YouTube channel, where both the sessions that Dr. Alok referred to, the how to file your first patent and the authorship, the research methodology by Professor Naveen, you will find all of it and much more. So I'm just pasting, check your chat box, you will get the link. So meanwhile, I would request if anybody else from the panel.
If I may ask just one question, Pankaj, are you IEEE member or ComSoc member already?
No, actually, I'm not a member of any one of them. So actually, I just want to know the process about that.
Okay, no problem. So you can get that even member or no member. But I think, it would be nice, you should look into what this IEEE and the professional association does. And that could help in your professional growth in a broader sense. Thank you.
Right.
Yes,
And today,
thanks for your
today there
advice.
is an event. Sorry, Pankaj, go ahead.
No, thanks a lot to you and then Alok Nath sir for your expert advice, and I will definitely follow your advice, and then I will contact you offline with my idea. So thanks a lot for your invaluable suggestions.
You are welcome. And Professor Naveen also has something, but before that, just wanted to say that at 3 o'clock today, there is a session. If you have not got the invitation, Chengappa can paste that link here. You can actually join the 3 to 5 o'clock session that talks about the membership. So please do join at 3 o'clock.
Sure,
yeah,
sir.
Naveen
Thanks
sir.
a lot.
Yeah, Naveen sir, you wanted to add something?
Yeah, okay. Thank you very much. So thank you, Pankaj, actually coming up with your query, and I think that Dr. Alok has clearly mentioned addressed all of this. I just have one point to say that like you, there are not one, there are hundreds and hundreds of people, especially those who are working in industry. So they are facing the same type of challenges. And our suggestion is just contact us. Okay, just contact us and we are there. So you reach out to us through email or ComSoc website you visit, you will find some contact, or otherwise try to contact. And the best thing is IEEE platform where people are so polite, so educated. We are not that much, but you see at the global level, you see the leaders, those all the company leader you find, they have been the IEEE member and they are IEEE member today. Marconi, you take Graham, you take all of them. So it is very good for everyone to network. Networking and openness is very, very important. So please don't keep yourself under closed house, arrest. Just open up, be in contact with us, network, and I think you will find all your problem solved. Thank you very much. This is what I wanted to say.
Thanks a lot, sir.
Sir, I would like to add to what Naveen sir said. Into the IEEE platform, most of us have come by choice and not by chance. So all of us are willing to volunteer. So anybody reaches out to us, we have a big team who can render the helping hand. So please reach out to us.
Great. Anybody else? Subodh, you want to add anything?
Yeah, Subhash. Just one point. I think the query which Pankaj had, right, and building on what Dr. Alok, Naveen, Shobha ma'am, you said, Pankaj, I would say this, there is a lot of work already happening. You know, if you're looking at my video now, right, we are all, when we file patent, we think more about the depth versus the breadth. I think you have ample knowledge if you're working in IoT or 5G especially. Patenting happens at intersections. There has to be a value curve. I think the mistake,
Okay.
and I personally, I would say the journey before I filed my first patent or the journey afterwards has always been the mindset. The simplest solutions were always there, right? For example, if you are listening to what Rag said, the simplest technologies were CCTV cameras or wireless. You don't have to innovate the next 5G or the cool G wireless camera. If you're counting number of people entering, combining that or using wireless controllers to know the distance they're apart, you're solving a human problem for COVID, social distancing. Just giving you an example. So one of
Yes,
the
sir.
fundamental rules is not go for the technological depth or the breadth, but go for the value. Why would Pankaj's patent, if it is MIMO in 5G, be adoptable not just by Reliance Radisys or say by Cisco or someone, or even by Samsung or Qualcomm? So don't always run after the next coolest, fastest, or the better thing, right? For example, just giving an example, the greatest and the fastest working things are never patentable because that is an obvious thing. Take silicon density, take optical networks. So my journey of patenting was always about how are you intersecting technologies and solving the simplest problems. I'll be bold enough to say, with your how much 12 to 15 years of experience now, right, in MIMO or 5G, can you pick up one industry? Under that industry, look at 10 different ways in which 5G access for public and private 5G networks is working, and then take the top 10 challenges faced by factories, agricultural guys, or healthcare. Just giving you examples. And that is what
Yes,
this
sir.
IEEE society does, right? So I personally
Yes, sir.
gained immense value when you hobnob or, expand your horizons with experts like people on this group. And that makes you solve the basic question. Is my pattern just feeding my technical hunger, or is my pattern really filing or solving a problem out there? And that is very important, Pankaj. Because remember,
Yes, sir.
it is not about being the next Einstein or Newton and with your algo or something. It is simply about solving problems. If you come from that lens, it will get very easy for you. Whereas when you start with, okay, let me invent the next now, what next after MIMO, there is no end to it. I'm not saying that is less important, but I'm saying the mindset needs to change from just the speed and the efficiency to value. And that is what is sorely missing, not just in India, but overall in the patenting scene. So we welcome you aboard, as Dr. Alok said, leverage us. A lot of us have learned on the way. And let me also, take the liberty of answering. One of your question was, I know you expressed this very candidly, so I'm saying this with equal candidness. You said you feel stagnant in your job, right? And I think a nice way to look at it is, are you, when you say you're doing the same things again and again, we humorously say, oh, I'm not growing, I'm not innovating. So all it needs is that shift. What can I innovate with what I already know? Sometimes you don't need to innovate the next wireless protocol. You don't need to build the next AI bot. You can solve a problem and then look at how these adjacencies come together. We are very keen to happy you, to support you further your cause. So please do not hesitate to reach out. We're there for you guys.
Thanks a lot, sir, for all of these points and then giving a different angle about all of these innovations and patenting and so on. So really thanks, and I will definitely reach out to these all of these experts and then leverage their experience. Thanks again.
Thanks, Pankaj. You represented a big sector in the tech industry, so thanks for bringing it up. The next question, this comes from Sangeeta. So, Sangeeta, would you like to talk about your question?
Yeah, good morning, all of you. Thanks for conducting this session. And I really, the title Ask Us Anything was really comfortable. So I feel like, like very comfortable asking anything as of now. And I have a list of questions if it's okay.
Please go ahead.
Yeah. So the first thing is I'm doing my PhD in software-defined networks, and I wanted some expert guidance from the people who are, like many of you are always supportive and helping, but most of the time you're all busy. Like initially, maybe I can contact and few replies I will get, but eventually it happens that you're all so busy. Can you just suggest some people who can maintain that mentorship for a long time?
Who would like to take Navin sir and Shobha ma'am maybe?
But she said she has a list of questions, so she can put up. No?
Okay.
Or you want answer one by one?
Yeah, I'll put up all my questions.
Okay.
The second question is, it might be very silly for you people, but when I'm renewing my IEEE membership, I can't use my debit card, or there is no option of Google Pay. It allows only certain credit cards, which I do not have. It becomes difficult for me. Every time I have to ask somebody else to renew for my sake. So whether that provision can be made, that's the second question. And the third question is, as of now, I'm writing my PhD thesis, and according to our university, we are not supposed to write the content which we have already published as a paper. So while writing paper only, I would have put in the best words and sentences, and rewriting it again in a different way, I'm really finding it difficult. So how to go about that? That's the third question. And the fourth question is, I wanted to implement this SDN in our campus, in our college. So whom should I approach to get guidance related to this?
Can I
So
take?
probably I will copy paste all these questions in the chat window so that you can look into it. Thank you.
Navin sir,
Okay,
how about you?
okay. Yeah, thank you. It's very good question. So coming to the first question of continuous guidance. Yeah, you are right. See, you can approach definitely, and a couple of time one person might assist you, mentor you, but it is a continuous process. If you want a regular and continuous process to be in touch with expertise, definitely, I mean, he or she will not be without any cost. Cost, I'm not saying in monetary, but in that case, why don't you try to keep him or her as a co-supervisor or as an external expert in your DC committee? So these are the provision where you think that that person will be connected and that will be bound to give you suggestion always. Otherwise, my personal opinion, of course, let's say I'm very helpful, I can give you, but it becomes very challenging because I don't have only one, and I can give you a couple of examples where I have been sufferer personally, not one. So, I gave you for one of the paper which was so rudely written, but it was a very good paper. And I worked really personally to modify that paper for 1.5 year. 1.5 year, at least 4 5 iteration I did, and I brought that paper to a IEEE transaction status. And we were no ready to submit. Initially, 5 6 iteration I did free of cost, but they are still coming, sir, sir, please do this, please do this. So then I told, then if you want like that, then at least in paper we should be co-author. Otherwise, why I should waste this time? You have just put some draft, and then everything I am doing, then why I should do and waste this much of time? Then they agreed, okay, no problem, sir, in fact you supposed to be. Then I started, and it took 1.5 year of time to bring it to that status. And finally, you know what happened? They said that there is some work, so our supervisor is calling, I mean, university is requiring something. And then I said, okay, fine, please go ahead. And now I see that that paper is published somewhere in a very scrap journal. Very scrap journal. That journal has no meaning, and nothing is there. It means I can throw a paper or piece of paper and that can be published in that journal. So it is of that kind and without my name, and ABC is added and that paper is published. Now, these are the situations that happens if I contact you and try to mentor. Now, why people should do this much of pain they should take? I have wasted, at least if you count number of hours, I can sincerely tell you more than 45 hours I have devoted on that paper for 1.5 years. I could have generated and I could have done a lot of things. So just to answer, I don't say that everybody does that, but if you want a continuous mentorship, it is the best to bring him or her as a co-supervisor or as a subject expert from external company, external institution, and so on. You can get that very constantly and always. So that is number one. Second, you had, which also I will answer perfectly, on IEEE payment. So IEEE payment, of course, there is a provision NEFT transfer, but it takes a couple of days, but you can do it. So there is a provision when you check out, there is a provision or say whether you want to generate bank challan. So if you open that option, they will give you account information of a bank. Okay, using that you can pay as a NEFT transfer, and within 2 to 3 business day you will get confirmation that your membership is done. And I think some more payment option has come recently, like RuPay or something other, but this NEFT provision is there. You can definitely go for that. Third thing I would tell, go to IEEE site, there is a live chat. You put up any question, anytime, and there is a live chat, people will answer you. So don't hesitate to use this on IEEE main page, IEEE.org, live chat, you go and people are there to answer any query to support you. Okay, so that is the second part. Third you had is PhD thesis, similarity report. So I'm telling you because I have all this experience. That's why I said that Subhas that gave me chance to tell. For similarity report, there is no option. University demands you less than 15%. You have to maintain 15% less than. You have to rewrite. You have to rewrite again in your own word to minimize the percentage of similarity. You can take the help of some of your friends, colleagues to bring out the similarity report which is required by university. Less than that, whether you have published before your own paper, doesn't matter. It is a university requirement that percentage of similarity has to be less, and you have to rewrite. You have to rewrite in your own word. You might mix, Bhojpuri or Tamil or whatever, but you have to rewrite it to bring the similarity report less. Okay, there is no other go for this. And I want to answer the last one, which might not Subodh or Dr. Alok or Subhas can take it up. Thank you.
Yeah, should I just answer the third part? I think that Professor Sangeeta had for it was for SDN use cases, right?
Yes.
Last one, last one.
Yeah, so I'll just say this, Sangeeta ma'am, that again I prefer to use the word simplicity more often. I think it is really underutilized and least understood, right? SDN again is nothing complex. It basically overcomes the traditional challenges of what is been working for 30 odd years in control plane protocols, right? So whether you take, I'm just using some names like the routing protocol of the internet, BGP or OSPF or spanning tree protocol, they all had limitations because even imagine this WebEx meeting, we are all watching, viewing each other. So the graph of the bandwidth and everything goes up and down. It's very dynamic. The existing control protocols like OSPF, BGP were very static, which means once configured, there was nothing you could do. All SDN does is give a lot of programmability in the data plane layer. Now, if you're doing a research in something like latency-based routing, dynamic QoS, these are the real use cases. Use cases is not saving on network equipment costs and writing a new fudgy protocol, right? So SDN's use cases is dynamic QoS, latency-based hop-based routing. All these things are genuine problems, which the companies like Reliance, Airtel, Vodafone, AT&T, Verizon are facing. SDN brings that dynamic controllability. Even right now, as I'm talking and I'm waving my hands, WebEx understands on the network that maybe 10 kilobytes per second needs to be transmitted more for me. If Naveen sir is sharing something, something more comes from that. So the network needs to be intelligent. And all this can only happen with a software-defined approach. And that is the promise, premise, and the operability of SDN. So I'm not here to, I'm sure all of you understand that, right? But the most research for SDN has always been for this. Immediately, I can point you to, if you look at optical circuits, the long haul optical circuits, the submarine cables going under the sea, there is so much work pending there. And I would highly encourage you to look at SDN from that perspective and not just about, let me take a little bit of open flow, let me take a little bit of NFVI and try to, patch something which already exists. There is no innovation there. And that will really help you write a powerful paper. Do reach out again. I'm saying happy to help you. I work actively in that area. Part of my responsibility is to migrate the legacy static protocol control plane networks to the programmable networks using SDN and FEI. And I'm sure most of you on the call know that a lot of 4G to 5G migrations will actually, in simple English, be efficient or break down how we do SDN migration for the radio, for the access, for the core. So it's a big promise for the future of internet too.
Sir, I wanted to know how can we should set up a SDN environment in a college so that we can give a practical view of it for the students.
Yeah, sure. I think between Naveen sir and me, we can help you. Naveen sir, did you have something in Amrita for the SDN lab, or I can share something as well. I don't know what use cases you want to build. If you let me know, we can start with a high level view and then take it forward.
Sir, I'll get back to you. As of now, we are doing these labs on Mininet using POX controller and Rio controller. Like everything is like on emulators only. I wanted to check if kind of real SDN switches or controllers could be used in a lab and demonstrate that. In fact, once I had visited BMS college for a workshop, they are implementing SDN over there, but they have taken that SDN controller as a proprietary. What I want to do is open SDN. So if anybody can, if you can suggest who can help me that open SDN implementation in this network, it would be helpful.
Maybe I'll just add on very quickly. Probably you can reach to us offline, but if you buy an edge core switch and on top of that you can put, there is something called ONI OCP, and they are fairly cost effective switches, white box switches. And then on top of that, you put an SDN controller like UNOS or Open Daylight. All these are in open source, right?
Okay.
And you should be able to set up your environment. And if you want to make it even simpler than that, you can just put Open Networking Linux, and on top of that, you can write your applications straight.
Okay, sir. Thank you, sir. Thank you so much.
Are you from Ramaya Institute of Technology?
Yes, ma'am. Yes, Shobha, ma'am.
I'm familiar with you.
Yeah.
I can connect you to Subhash sir and Subodh sir. Okay. And one thing I would like to tell you is there is no substitute for hard work. So whatever is required, we have to do our homework first before reaching out to the mentors. So when we are really stuck and we don't have an option, we try to reach out to the experts they will always come to our rescue, but continuously we keep probing them on a continuous basis. It is very difficult for people to pull out their time in the busy schedules they have and give continuous mentorship. So let's do our homework first before reaching out to experts, and persistence actually will take us to whatever levels we want. If we are behind a particular problem and we are continuously perceiving that, we can always solve it. And coming to your question of PhD thesis writing, where you're finding difficulty. So when you have published a paper and you find similarity of that when you are writing a thesis, it is your same work. So, you know, in and out of it, you can just try to reframe your sentences in a different way. That should not be very difficult at all. So I think you can also use some online methodologies where you can use some paraphrasing and try to look out for alternative ways of writing things if you're really finding it very, very difficult to manage. Okay.
Yes, ma'am. Thank you, ma'am. Thank you, all of you. Thank you so much.
Things have been answered by the other experts.
Thank you, all of you.
Thank you, Shubha ma'am. So there are a lot of questions on chat and there are a few hands that have gone up. So what I will do is I'll very quickly take the questions on the chat first because they came in that sequence. So bear with us for those hands that have gone up. So the next question came from Amandeep asking whether there will be any certificate and when will you get it. So Amandeep, we are not issuing the certificate for free events. We actually, at the beginning of pandemic, we were issuing the certificate, but it was a lot of logistic work. And then we thought that it is best that if there is a paid event, we'll put the certificate. Otherwise, we are not issuing certificate. But thank you for joining. What is the next question? The next question comes from Raghav. Raghav, would you like to unmute yourself and speak out your question?
Sure. So hello all. I'm a final year engineering student and I'm about to start my career as a software engineer at a tech company in Bangalore. So I just want to know from all of you experts as to what should I focus on in the coming 2 months that I have before I start, so that it's an easy transition for me from academia to industry. Yeah, that's what my question is.
Open to everybody. Anybody would like to take a lead?
Subhash, maybe I'll just start and then I'll request anyone from the panel to build up, right? I'm sorry, I missed the name. Was it?
Raghav.
Raghav, okay. Yeah, Raghav. So as part of Cisco, we have an early in career group. I'm a mentor for them. And I think the first thing we always tell them is, you often hear, Raghav, of this business to business and business to commerce, right? So this campus to corporate doesn't require a different rewiring of the brain. I think it's really just a mindset. And I think I'll say this again and again. First is don't be in a hurry to learn everything. Don't go by the breadth equation. Understand simple things like which business unit you're joining, what is their, simple one-word English strategy, what do they focus on? For example, let's take SDN, right? If you know that SDN and some constructs of open flow and programmability are going to help you, it makes more sense for you that every time you study some things, try to map it to the SDN world. So I think the applicability matters a lot. The other thing is, I've always fully respected the ability to ask questions. I've always felt, unless you ask questions, even if you go back half an hour on this call, the first person who started with that question sets the ball rolling. So don't hold yourself back. Be bold, be candid. Maybe in some college environments, you might be stifled in certain ways for various reasons. In any corporate, as far as I know, when you ask, just, all you have to start is, I'm sorry, I don't understand this, but can someone explain this to me? You'll be surprised how many people, just like you find on this call, will actually reach out and help you. I think that is the basic of human existence, right? We all help out each other. We care for each other. So just raise your hand and say, I think I'm part of this and I don't understand this. And the third, more like a tip, I would say is always leave a trail of evidence. Whatever you start in your first 3 months, even if you're writing a little, design guide or try to document it, share it within 10 or 20 people in your team. When you leave the trail of evidence, you're actually helping 10 more people to embrace that path. That really is what comes to the top of my mind. Thank you.
Got it, sir.
Just
It was
add
very
a little
insightful.
bit. I think Subodh has explained that campus to corporate part of it. Two things that change is it's very subtle and it could be a little challenging for some people because in campus you're very freely, you are waking up anytime, joining things, doing your own way. The freedom is substantial because you are either doing your research or your coursework. When you come to corporates, I mean, there would be a little bit of discipline that is required because there is a fixed time. There are certain norms, and if you are part of MNCs, some are with Korean background, Japanese background, European, American. So there would be a DNA or a characteristics of that company. So I think it is very, very important to a little bit get hang of that and align yourself to start with. You may not like 100%, you want to change something, but the rule is to be part of the organization first before you start to change. Many people try to change or comment too early. That just doesn't work many a time. So come halfway and then start engaging to do it. So this is one part that I wanted to say. And the second thing that I think people miss it out, and it's a corporate norms, is ethical transactions. I highlight quite substantially. I believe in it. And, it is very easy, even in campus, if you're not attending, somebody gives proxy and things like that. Even there, I think things have changed. Things have changed. But nonetheless, it will be seen like, okay, fine, you did it, but you didn't mean it or whatever. You will be excused. In the corporate world, and many are quite tough, even swiping once, somebody else's card could be seen a very strong way. This is a fundamental value. So I would like to highlight again, I mean, you just raised the question, it's not about you, but I'm just trying to address this in a broader context. Understand the corporate culture, the country culture, the specific DNA, and start respecting this broader, the values that company holds. Each company has their value sets and they mean it. Something cannot be compromised, and sooner we understand, better it is in that context. So these are my just two general comments, and not about our companies, but for in general. Thank you.
Anybody else want to add anything? Okay, then I move on to the next person. There is a request from Gauramma. So she said that she has a question. So Gauramma, floor is yours.
Good morning, everyone. Sir, I want to congratulate Raghavendra sir and team for wonderful work they have done in this COVID. And also related to that, we have done doing one project, sir, our 8th sem project. I am guiding that project. And this is what I am posting. I think, okay. Using dynamic models to showcase pandemic. If the question is there in the chat, sir. Using dynamic models to showcase pandemic prevention measures, empirical COVID-19. So these are the goals, sir. What we are doing already about to complete this project. The main goal of our project is to design ecosystem where we will provide a complete solution for the patients suffering from COVID and precautions and checkup for all people. Monitoring the patient health, monitoring the oxygen level and temperature, sending to the doctor, and then the doctor will see those parameters and they will suggest. This is what really happened to us also. We had online doctors, then we used to send our SpO2 level and then temperature to doctor, and then the lab reports to the doctors. They used to guide through WhatsApp. That's what I implemented this to our students to do, so send alerts of medicine once the prescription from the doctor used to come, then we used to send that to the medical shop. They used to do because they were no one to purchase the medicine, so the medicine used to come from that medical shop. And also, so many people they don't know cooking, or if they no one is there to support us for giving food. So we thought of connecting to NGOs. So this is what, or otherwise Swiggy or other media. So this is what we thought of doing platform for that, so that they will bring food and they will keep outside and they go. So, and another one thing is mask, face mask detection. We all did with this is different model. So I want from Raghavendra sir how to connect these things. That's what we wanted to know. So, and live corona updates, bot and videos. So we are putting in our platforms, which helps to recover the patients very soon. Some tips like how to get oxygen level if you do some pranayam and all. So our kashaya, how to do kashaya, because so many people doesn't know how to do. So some tips we are keeping in our platform, so that if they see. And also one important thing I learned from sir is counseling. That was not there in our, that we will try to include that also. So this is what our plan is for this COVID-19 to do project, live project. Our students are about to complete this. Sir, I want to know how we can connect all this, because all these are different thing, and also we are doing hand sanitizer, not the left pedal. We are doing that sensors one. If you keep your hand and only a small drop will be dropped, sanitizer, hand sanitizer, so that we can clean it. So you have seen hand paddle, they will touch and they will make the hand sanitizer to spill. So this is what disadvantage we found. So all these are different modules. I want whether this title is correct, and also I want suggestion for the title, and also is there any connection we can do, so and where it can be implemented. This is what I wanted to know from you, sir. I am finding a mentor where I can ask all these questions. Now I found a very good platform where I can ask all these questions and make a very good project as a system. Thank you, sir. From my side, this is a question, sir. Over to you, sir.
Okay, so first of all, it is good that you're taking up so many projects. All of them seem to be relevant to COVID.
Done by my three students, sir, all this, but I want to make it one system. As a whole,
Yeah,
title
I think
suggestion I want.
there are multiple ways to do it. If each of these projects individually are working fine, right?
Okay.
You should first try to get there are so many projects. Even if
Yes.
one or two of them succeed individually in working fine, then you will be you should feel happy that
Yes.
they're working fine,
Yes.
and only then look to combine all of them into a system. Because if you prematurely try to force fit into a large system, then
Okay.
it's better to focus on, like, for example, if you're monitoring SpO2 on temperature, and let's say it is a hardware, just getting
Yes.
that right is very important.
Yes.
And
It's
because there
IoT
will be
project.
hardware software combination. Also, you should see for each of these projects what you are doing different from already things that exist, right?
Okay.
A lot of things here may be existing.
Yes.
The project should clearly not at least if your the goal is to get the student to learn, you should try to do something which makes like, for example, if you're doing SpO2 temperature, which makes it better than what exists today, right?
Yes, sir.
And
That
add more value.
we have taken care. Proposed system we have taken care. So antenna is there, and so to overcome that only we are having the sensor. Like in five-star hotel, there will be sensors like that. So it will, and also there will be a knob where it will give only one drop of sanitizer, like that. We are planning IoT project.
Yeah, so see, if the goal is just for students to learn and get a experience, right?
Yes.
Then that is a very good goal by itself, right?
Yes.
And you should not worry too much about about anything further, because that itself will make the student confident that they can do something by themselves, correct?
Yes.
So yeah, the secondary goal could be, hey, a lot of people should use it and get adopted, and it should be part of a system. If your primary goal is met, I feel you should be feel happy, because at the end of the day, these students will be future engineers who will be able to do a lot of such projects on their own, because they learned it from from doing this project, and they'll get a lot more confidence.
Yes.
Thank you, Rex.
And also, for the panel member, one more question. Sir. For faculty members, if you they do an workshop or FDP or whatever, so for counseling, how to counsel the students and then parents. So as some of them ask question about the students are not writing the exams and they will give reasons, and if they are right, so for that reason, if you have the FDP, how to counsel, because we don't know how to do professional counseling, as sir was telling. So if we learn, then so that we can do better counseling, so that our students will start writing the exam, their assignment. Whenever we say for them to write assignment or any surplus test, they will say we are not feeling well, something like that. If we know how to do counseling better, then we can mold them, and they will come back to the track and they will do all this, because we will not come to the other side of them how they are learning. Because of this, results are going down, as I felt. So if faculties have been trained how to do counseling, so it will improve the result of the students, and we can monitor the students better. And also we can counsel the parents also to monitor them, because they are the one who are taking care in that side of the part. So
Yeah,
that's
so
what I request, sir.
Dr. Alok and Mr. Subhash, so if there are a lot of such requests by
It's very
lecturers and
necessary, and the
students,
rules are going down.
Project StepOne will be very happy to take up a mental health first aid training program for teachers. In fact, we have done a lot of this for school teachers, and I think it will only be better if college lecturers are also trained on this. Will be more than happy to facilitate a training, and it could be IEEE can take a lead in organizing a lot of these lecturers and teachers to attend this session. We'll be happy to facilitate that.
Thank you so much.
Thank you, all the panel members. It's a great work you people are doing. Thank you.
Thank you, Gauramma. Dr. Alok, you want to say something?
No, I was just saying thank you, and you still have a lot of questions. We have
Yeah.
11:55, so let's take it up.
Yeah, so I am hoping that everybody is okay to stress a little bit. I think we have a lot of unanswered questions, and initially I was a little scared whether we'll have enough questions, but now I'm very happy that we are overflowing. So I'll move to the next question. This is from Sampada. Sampada, I would request you to speak up your question, please. Sampada, are you still there? Okay, so I think we will move on. So the question was, I am a pre-final year engineering student and I am an executive member, SAC chair. Sir, I have a fear of appreciation. How to overcome from this? So anybody would like to take this question, since the Sampada is not there, but at least from the recording, she can benefit.
Is it fear of appreciation, or for appreciating, or getting appreciated?
So I just read out what was written. So I also had that question. So I cannot clarify any further.
So if it's you are not doing an appreciation, that's more like a hesitation than a fear.
Yeah.
Maybe if it is getting appreciated, then we should check, like, is it like every now and then, every step that we take, we would need that some external endorsement? Probably we don't need that. So again, she's not there, so we can't answer effectively, but that's my short note.
Yeah. Thanks, Dr. Alok. Anybody wants to add before I add few things?
Because question is not clear, so I don't think what he wants to say. It is difficult.
Okay, okay. Yeah, just I wanted to just say that if you have this kind of questions, I can say that reaching out to StepOne to the helpline, this kind of question also gets addressed, and they can guide you to go to the appropriate forum as required. Like there are quite a bit of counselors available, right, on the platform. So all of you who are having this kind of question, please reach out. Rags, would you like to add anything?
Yeah, absolutely. I think anyone feeling the need to speak to something about something which is very personal, which you are not, um, which you don't want to discuss with someone you know or someone who um, you know, who is around you, you can feel free to anonymously call the Step One helpline and discuss with someone who will keep the whole discussion very private and also help you with your query or question. If you're feeling afraid or excessively you're having excessive fear or excessive anxiety about something, also you please feel free to call. And or if you have something which is in your mind and you're not able to take it out of your mind and it is harming your day-to-day work, because of that you should call. So if you are in doubt whether you should call or not, even then please call.
Great. So next there is a question from Ajit TN. Ajit, could you unmute yourself and speak your question?
Yes, sir. I hope I am audible to everybody.
You are.
Sir, the thing is, I am from academia, and what I have noticed is the admissions, for some branches have reduced in some colleges. So as a result, the some faculty members are being laid off. That is, even the senior members, like associate professors, professors who have completed PhD, are being laid off. So even in the industry, the layoffs are happening in some companies. So my question is, if this does happen, so how to be better prepared for this uncertainty? Like, should I be conversant with any new technologies, or any other inputs from the panel members are most welcome regarding this? Because I think many people do. I think many people have this doubt, if they do lose their job, how to go about in the future. Hello?
You would like to take? Yeah, we heard you.
I could take. I think,
Please.
the university part, I would leave it to Professor Naveen and Shova, but just the industry and generally, I think your question is much broader.
Yes, sir.
See, yeah, so I think one is a business directions, and always there would be optimizations and there is pressure. So that kind of things will continue to happen. So it is not always a reflection on a person's achievements or accomplishments and things like that. So if you are, I don't know exactly what topics you are working, but let's say if you are working on a good topic that is relevant in like 5Gs, let's say just a case, and there is a lot that is going to be happening. So your skill set is relevant. Maybe an individual company or places could be affected and you would be placed there. So there, I think you need a little different kind of preparation to keep yourself ready, and what value you offer in the present context that you should assess. But other point I wanted to highlight is, if you are working on a very relatively older topics, or because it is your passion and somebody started, or that's what you did way back and you are continuing, I would like you to, all these upskilling that are happening, because the whole world technological disruptions and the pace is quite fast. And on one hand, you are not requiring all the people in some steady state work. Whereas, the whole blockchain world, the whole quantum computing, it's moving so fast. We had a session other day, 4 hours, and they are looking for people, and there are not enough people to do those business analytics. So I think, in short, If the skill is relevant, but company or your places is not, then there is an alternative places and you should repackage and think it. If it's an older aspect and many people are into that field, like for example, embedded systems, there was a time that tons of people that have done and cloud came. So obviously when cloud came, nobody knew that. But with cloud and edge, somebody who has a partial knowledge of cloud and also did in the past embedded, maybe they could choose an edge kind of work which has both dimensions of it. So I think careful choice of topics in the present context is very, very vital. That's my simple suggestion.
Dr. Alok, anybody else? Navin sir?
Yeah, so since Dr. Alok referred no academia, he does not he doesn't want to comment. So okay, so one thing is common whether you are in academia or no industry, upskilling is very important, and I think this is the right time. You save a lot of time in travel that you used to do. So it is better to make use of this time in upskilling. That is number one. It is very, very important. Second is, see, when we are working in academia, it is also important that we should try to generate revenue out of ourselves. How do we do that? So we should keep writing, let's say, book, and that gives you a revenue, maybe small, but it is always and permanent. So even you are sometimes laid off, or you are, let's say, taken 2 years off from the academic regular duty and so on. At that time, you are not finding so difficult because you have some additional income source when you were active and when you did all this work. So continuity of your research, continuity of your project, continuity of writing book, continuity of writing papers, that should continue. And if you continue, I think, for example, I would like to some rest. If I get rest, I might write a book, which I have a plan for a long time, but unfortunately I'm not getting time. What to do? So I think in that way you should take it positively and utilize your time when you are off. So that is what my comment is. Thank you.
Ma'am, you want to add something?
Yeah. So this is a temporary phase, and we don't need to panic about it. If we are having very strong skill sets, we can use, like how Naveen sir told, the time that we have got in upscaling ourselves. And we could be looking at, as academicians, we could be looking at, assuming that you are from academia, I am trying to answer this. We could be looking at some funded projects or consultancies which will give us the usage of the knowledge base that we have, as well as give us some revenue in supporting our families. Okay, so I don't think we need to panic. If we are having very good skill sets, there is always opportunities which come our way, which we can be using in order to switch over.
Thank you, Shobha ma'am. I'll just add one thing before I move to the next. I think there are a few more questions. So one thing that helps in a difficult situation is really to count what we have versus what we do not have versus what I am likely to lose, right? So if we can count and take a positivity around what we have, I think it helps keeping that Three Idiot movie all is well. That really helps, right? So I thought I will just mention that.
Yeah, we just need to believe in ourselves.
Right. Absolutely. There is a floor request from Dayal and Deborshi. So I'll go to Dayal first in the sequence that came. Dayal, would you unmute and speak your points? Dayal is not sure. We are not able to hear Dayal. So Deborshi, maybe you want to go?
Yeah.
No, sorry.
audible?
Yeah, I'm here. I'm listening. So no, I don't have anything. Yeah, sorry.
Okay, that's fine. Yeah. Yeah, Deborshi.
Okay. So I am audible, right?
You are.
Okay, thank you, sir. So, sir, like I have again two questions to this panel, maybe a bit controversial right now. So, my first question is like, sir, like being a student, we find very much difficulty in like publishing our papers in IEEE journals and conferences just because of their very high prices. And we see that due to COVID situation also, we are not getting that much of discount or relaxation in those prices, even if the conferences are in virtual mode. Just for an example, in the last year, IEEE GlobeCom, that's IEEE Communications Society flagship conference, where like witnessed a registration fee around $300 to $400, depending on various members. That in the Indian currency, it's coming around 30 to 40,000. So, sir, my question is that like what we like how a student can publish papers in those conferences, and few journals also the extra pages are like quite highly charged. So, sir, what's our approach should be in those cases? Like funding is a problem, as you all know. This is the first question, and okay.
To say that IEEE's International Conference on Communication, which is next week, the student members can join, I believe, completely freely. There is no charge for that. There is registration. So I think the GlobeCom, yes, that was last year. And based on some of our feedback and things, organizations have opened it up, at least for student community, completely free. If I am fully right, I think Navin sir would be able to, endorse. But even some of the others are very nominal charges for tutorials and things. But yes, regularly going forward on your publication charges, that's a challenging point, but I leave it here.
Yeah, you're right, Satish. For most of the popular conferences for student participation, not that you have a paper. If you have a paper, definitely there is a registration charge. But if you want to register and just listen and take advantage of that, most of the conferences are free for student. It is not for us. For us also it is a minimal charge, but for a student it is free. So please take benefit of that. Keep looking whether it is from signal processing, communication like ICC, Globecom, WCNC, Infocom. There are plenty of them, and for a student, they are all free registration. Please do that. For registration as an author, it is a standard. You are talking about $300, but it is even $1,000, $1,200 as well. But for authorship, whether you are a student or you are anything as authorship, there is no discount on that because there is a charge involved in the publication papers and so on. So it is a headquarter and MC decision. So by that we do not have anything where we can make you discount or so on. But at local level, for example, no, we have some provision where we encourage a student, if you are a ComSoc member, if your paper is accepted to a conference, ICC, Globecom, or WCNC, like that sort of conferences. Please reach out to us, and we see that some travel discount and other thing is given. I'm just talking about on behalf of Dr. Alok. I think those provisions exist in ComSoc. Some help can be given to you on this basis, right? Thank you.
Thank you, sir. I have another question. The second question is like, sir, like we see that in this like PhD or research scholar life, what we see is that it's a kind of peer pressure competition of publications. Okay, so in that case, what sometimes happen is that we are kind of in a hurry to publish papers. Okay, rather than the quality work. So in a simple way, if I summarize that, the quality and quantity in research work. So, sir, like few institutions also have some restrictions that you have to have some some limited amount of publications in these journals. So, sir, like if we hurry and more focus on publications, that sometimes we feel that we are lagging in the quality work that needs time. So, sir, how to deal with this situation? Yes, I guess. Yeah.
My point is, don't be in hurry. Because if you want your career to grow like this, you have to focus on quality. So don't go for quantity. It is a temporary that okay today. I mean this academic year you might not get increment. It is fine, but next year if you are submitting a transaction paper because you have worked this year very nicely, so you will generate a very good paper next year, and that will compensate the losses this year you had. But in long run, quantity is not going to work. It is the quality which will work in your career. So when tomorrow you see your paper, you will appreciate yourself. But today, by chance, if you have published a paper in hurry and that has no quality, and tomorrow if you go visit your own paper and download, I think you will be the first person to curse yourself that what type of paper I published. But once it is published, you cannot withdraw it, right? So please focus on quality. Don't worry about quantity. That is my point. Thank you.
You want to add anything? Ma'am, you are on
Mute. You are on mute.
Okay, we don't need to compromise on quality for quantity. So always focus on quality. The rewards will follow.
Ma'am, actually, like how to follow the institute guidelines, that we have certain commitments there as well. Because like if we don't have certain amount of publications, we cannot get our degree. So how to like
Yeah, see, you
You
can
afford to take a bit longer time also, right? Sorry, I'm just jumping in just to say that you can afford to take a bit longer in PhD journey. It is not a fixed period. That's why. I mean, bachelor and masters are like that. But PhD to maintain quality, I mean, sometimes it clicks. It's not about, again, people's IQ, but it's about what problem you have taken and your pace and what else would you like to do parallelly. But bottom line is quality is a must. If you need to take 3 more months, 6 more months compared to somebody else, then take it to do that, right? It pays off in the global context.
So you can take the help of the students, your MTech students and UG students, try to uplift them as well by giving your inputs to them and trying to build parallel works so that you can get a lot of publications as well. So you can use the community which is around with you, the student community as well. It will help them in uplifting their knowledge base as well.
Thank you, ma'am.
I guess we pretty much come to the end of the question. Raghavendra, I think I saw your message. Thank you so much for making time. We actually are just going to do a vote of thanks by Chenkappa. So if you can stay back for 2 more minutes, otherwise we understand. Thank you
I
so
just
much
need
for.
to ask one important question to Raghavendra. You know, as you have put this COVID situations and how you are managing, but we are also talking about, possibility of third wave, and irrespective of whether it is officially third wave or not, the time till the vaccination happens, there is still a challenge. Would you like to put into minutes, how you are planning for the next 6 months, what kind of things, and IEEE, even at individual level, if you want to do some volunteering as a think tank, not always going on the field, would you have any suggestions for us? I would like to ask that. Yeah, mute.
You are mute, Raghu. You are mute.
Yeah, so we are, as the number of cases are coming down, we are getting some time to think about not only think about all the things that we should be working on, which is vaccination. I think there is a lot of things that we are doing with respect to vaccination. I'll be happy to share some of the things that we are doing. But specifically, the interest is or the goal is to get as many people vaccinated as quickly as possible. And the problems in doing that, of course, there are hard limitations with respect to manufacturing and capacity of vaccines, but those are getting solved. But there are softer issues with vaccine hesitancy, misinformation, and also in some certain cases, hesitancy because they are under certain medication and they are afraid how, or they don't know what to do with their existing ailments and medication and how it will affect. So we are actually working on helplines and various ways by which we can counter misinformation, help people with hesitancy, and these are again very similar to the work that we are doing with COVID. In addition, we are also looking at ways by which this is an area where bots and some of the other technologies can help, because the scale of COVID was very small in compared to the scale that we want to reach. We have to reach to get a large number of our country's um, population vaccinated. So this is an area where certainly a lot of technology is going to help us. In general, we are looking for help certainly from IEEE, given there are a lot of engineering brains who can use technology to effectively help with some of the problems. We'll be happy to expose many of these problems so that they could be taken up as problems to help StepOne from within IEEE, as well as many of you can help us with your own corporates or your own colleges, get communities of engineers to volunteer and help us in specific areas. Also, we are actively working on certain aspects, like for example, we are giving equipment to some of the rural hospitals, and those are areas where CSRs in your company may be interested in. We can do the job of connecting these hospitals to the CSR team so that we can quickly get these equipment to these hospitals and save lives. So there are various ways in which not only IEEE but also through the IEEE network, other organizations that you're all working with can help us. So please stay connected, and I'll be happy to. I will request Mr. Subhash to pass on my coordinates, my email ID to everyone. So if you have any ideas, specifically, I message to Dr. Alok, the refurbishing, upscaling of the mobile phones to be used as pulse oximeters is something very useful. We should deploy this in as many places as possible. Pulse oximeters do save lives, but it's impossible for us to get money to buy new pulse oximeters across so many rural areas which are suffering. So all these programs and ideas that you probably are already working on, StepOne can be a channel to make sure that some of these programs reach the intended recipients faster as well. So happy to work more with the organizations, and also for all the academia. Everything that we do in StepOne is open source, so you should encourage a lot of your students to take part in these open source projects, because they are a good learning ground for students. They will also get to work with the industry experts. We have heads of architecture for various organizations who are working, and just getting to interact with them will be a huge learning experience for students, and we'll be happy to also reward these internships with certificates which could be useful for them in the future. So yeah, these are all the things that we could work on as follow-up with IEEE.
Thank you very much.
Thank you so much. I know you have to go. Sorry, we held you back. So on behalf of IEEE Communications Society Bangalore, I would really sincerely like to thank you from bottom of my heart. And we will be in touch. We will take care of you. So you may drop now, but I think if there is something else, we'll continue for a few more minutes and then conclude. Thank you so much.
I would like to once again, thank everyone for organizing this, and I hope we'll all work together and hopefully see the end of COVID, and so that we can focus on public health in general and trying to get a doctor very easily to every Indian. Thank you.
Thank you so much.
Raghavendra sir, we are proud of you. Being an MSRIT alumnus, I would really like to appreciate from the MSRIT family. You're doing a wonderful job.
You.
we would like to get associated with you and try to put our helping hands as well to help
Thank you so much.
serve the
Thank you.
community.
Thank you, Raghav.
Okay, so before we close, is there any other question? Doesn't look like. So maybe with this, I would request Chengappa to do a quick vote of thanks, and with that, we'll conclude the session.
Yeah, well, thank you, Subhash. In fact, looking by the questions in the chat window, and there is also a request for us to do these sessions very often. I think both our ComSoc members and potential members, as I would address them, would always be educated apart from the technical sessions that we do on a regular interval. So with this, again, on behalf of IEEE ComSoc Society, we are in fact extending our deep sense of appreciation and gratitude to Mr. Raghavendra Prasad, who was with us amidst his busy schedule from Project StepOne, who did educate us on some of the important initiatives that is doing with Government of India to address this pandemic times. And also for sharing more insights on the future programs and how we can collaborate with them. Further, we are again grateful to all our panel members, starting with our very vibrant ComSoc chair, Dr. Alok sir, Shobha ma'am, Naveen sir, Shubhodh sir, and also Subhash sir, who has been extremely kind enough to be the moderator and did help us in getting the questions from the participants to the panelist. With this, and also I would definitely like to again acknowledge our gratitude to all our participants who was with us for the couple of hours. And definitely, we would definitely take your request and see that if we can come up with such events going forward from ComSoc, which would benefit the community as a whole. And again, as we did mention that we have a session again today evening between 3 p.m. to 5 p.m. The details are in the chat window. So please feel free, where we would be in depth going and addressing how one can benefit from the professional benefits engaging with IEEE, and also on membership benefits, and also some of the insights into the process of elevating the senior membership. So until we meet again, please stay safe and keep the learning curve within you going. Thank you all.
Thank you, Subhash.
Thank you very much.
Thank you, Chegappa.
Yeah.
Thank you,
Bye.
team.
Thank you.
Take care.
And thank you to all the participants. Take care.
Thanks everyone. Cheers.
Thank you.